Welcome to Autism Today. My name is Joanne Gerenser, and today we're going to be talking about a topic that I think will be very relevant and important to parents and families living with autism and teachers and clinicians working with children with autism. I have two guests who are very knowledgeable about the topic, and they're going to be discussing issues of challenging behaviors. And hopefully they'll give us some insightful information on how we can help families and teachers in dealing with these very difficult behaviors that are often present in children and adults with autism. My first guest is Dr. Frank Cicero, and Frank is the Director of Psychological Services at the Eden 2 programs. And welcome to the show.
Thank you, John.
Why don't we start by having you just describe a little bit about what you do at Eden 2?
Sure. Well, Eden 2 is a relatively large program. We have children from preschool age, school age program, an adult services program, and residential services, group homes. And as the Director of Psych Services, what I basically do is make sure that every individual that we service has an active running behavior treatment program to reduce problem behavior, and also active running treatment programs to support appropriate behavior, to increase the appropriate behavior.
Well, obviously the goal is to make sure that we increase the behaviors we want to see and focus on that as opposed to too much focusing on the decreasing of problem behavior.
Right, ultimately what you would want to do is to increase appropriate behaviors so much so that it takes over for the problem behavior.
Right.
Problem behavior will then naturally just reduce.
Right. So let me ask you a question. What do we mean when we discuss or talk about challenging behaviors? I mean, can you just give me a little insight as to what types of behaviors we're talking about?
Sure. Well, individuals with autism engage in a wide range of challenging behavior. So there's no one specific type of challenging behavior, but there are some commonalities. First of all, there's the diagnostic challenging behaviors, such as stereotypic behaviors. These might be repetitive movements, repetitive arm movements, what we sometimes call hand flapping.
Yeah, the classic behaviors.
Or some of the body spinning, those classic autism behaviors. Mm-hmm. It could also be obsessive verbal behaviors, so very repetitive verbal, saying things over and over again, or hearing things that they've heard elsewhere and saying it repetitively.
Right.
Those could be challenging behaviors, but then you also have other challenging behaviors that are not always there, but sometimes are seen in autism, such as tantrum behavior, aggression towards others, self-injury sometimes occurs, non-compliance towards directives. So you do sometimes have this range of behaviors, and all should be treated.
So obviously, we see tantrums and aggression in typical kids, but I guess the problem in autism is that it can persist.
Right, well sometimes with autism what it is it's difficult to sometimes stop the tantrum once it starts. Sometimes one of the difficulties is not even knowing why the tantrum is occurring. Right. With typically developing children, you tend to know what happened because of their verbal skills. They can tell you why they're tantruming, or you kind of could judge what happened. With autism, sometimes you don't know, and it's an assessment process to find out. Right.
So, we work with a range of individuals with developmental disabilities, but it seems that with individuals with autism, this issue of challenging behaviors, of aggression, of tantrums, of repeating TV shows is much more prevalent than in other developmentally delayed populations. Can you give us some insights as to why? What are some of the issues that are causing these more frequent behavior problems?
When it comes to the diagnostic ones, such as the stereotypic behaviors, the hand flapping, body spinning, those behaviors, we don't exactly know why they're prone to those behaviors. It's part of the diagnostic criteria of autism. Probably some sort of self-stimulation that they're receiving from it. But for that, we don't exactly know. We just know it happens at a very high rate. For other behaviors, they're prone to them. One is a lack of verbal skills, both receptive, so how they understand what other people are saying, and expressive, how they're making their wants and needs known. Right. So autism is a language-based disorder and a socially based disorder. Right. And that combination sometimes sets up the individuals to engage in problem behavior such as aggression, self-injury. Right. So if they're not understanding what other people are asking of them, or they're not understanding what's going on around them, or they're not understanding explanations. Sure. So let's say they want something, and you give a very logical explanation, verbal, to them about why they cannot have that object. In the absence of understanding the verbal skills, sometimes their frustration might come out as tantrum behavior, aggression, self-injury. So those lack of verbal skills sometimes sets them up for problem behavior.
Right,
And also, individuals with autism tend to enjoy routines. They like things very structured. Unstructured situations sometimes lead to meltdowns. So
Sure.
where you think you're going to walk into a very pleasant situation, a birthday party, you're going to go to a trip to an amusement park, and you think, what a great day this is going to be. Sometimes it's the lack of structure that actually breaks things down.
Right.
And now the individual's engaging in tantrum behavior. You see rises in the stereotypic behaviors.
Right.
Because of that, all of a sudden, removal of structure.
Yeah, well, I know as a speech pathologist, this whole issue of comprehension, I see that oftentimes people, because the interesting thing about autism, right, is that many times their expressive skills are better than their receptive skills. So they actually appear to know more than they actually do. And so I think a lot of times what happens is people make assumptions and they'll say something that they think the child should understand, when in reality the child doesn't understand, and that's where you, I think, can see some of these behavior problems.
And the funny thing is, sometimes you just don't know.
Right.
So you don't exactly know what they're understanding receptively, but that's where sometimes the breakdown occurs.
Right. So, if we think about families living at home, in a school setting, it's our job to provide structure, but we have the staff to be able to do that ideally, and I think we'll talk about that later on in the show. But what a nightmare it must be for some families to try and cook dinner or even just have a telephone conversation and try and provide the structure that a lot of the kids need in order to not have these behavior problems.
Right. Well, that's one of the problems. Real life just isn't structured.
Yeah.
You have to impose structure on it, and sometimes that's very unnatural, at least at first, for a family, until they get used to having that structure built in.
Right. So later on in the show, we'll talk a little bit more about strategies for parents to be able to impose this structure. But I think what I want to just focus on for a few minutes is, this range of autism, right? So you've got individuals that are very, very challenged by their autism. They may not be verbal, but then you've got the other end, right? Individuals that might be described as people with Asperger's disorder. What are some of the behavior issues that population struggles with?
Well, you still have problem behavior. So Asperger's disorder, especially on the younger end, you still have tantrum behaviors. You still have non-compliance. But on the other extreme, you have social deficits. Okay?
Right.
And sometimes in the ability of understanding social rules, I could put it as. So
Sure.
in the inability to understand social rules, they actually engage in behaviors that the community sees as problem behaviors.
Right.
So talking out of turn, saying something to somebody that they shouldn't be saying, asking questions that they shouldn't ask.
Sure.
And given the environment, those could all be considered challenging behaviors.
Yeah.
I mean, if someone's very used to it, so that a family structure is very used to somebody's peculiarities with the way they speak and questions that they ask, they could kind of not see it as a problem behavior. But you take that same question, put it in a setting where people are less familiar with them. Now it's a tantrum behavior.
Well, I know. Interestingly enough, I had attended a conference a couple of years ago, and there was a person speaking from Pennsylvania, and he was saying that the fastest growing population entering our juvenile sex offender program in Pennsylvania are people on the spectrum. And it's largely because they're engaging in behaviors that they don't understand the consequences of. Stalking, for example, they get obsessed with somebody and they just won't leave them alone. And in this society, those kinds of things are just unacceptable.
And it's also, in the absence of knowing social rules, it's a fine line between what is dating and what is stalking.
Right.
And if you don't understand that difference, then the individual that you think you're attracted to and dating, they're considering it stalking.
Yeah. Well, I think, after we come back from the break, when we get into more what to do and how to help, we'll try and talk about this range, these kids that are nonverbal all the way up to the kids that are on the spectrum. But I think the most important thing, obviously, is this idea that we have to treat it. Right. These behaviors are not just going to get better. When you have children, and I know that when your children were young, 1 and 2, they probably engaged in problem behavior. But you said to yourself, I can't wait till they're 4, I can't wait till they're 6, and these behaviors went away. But
well, with autism, what happens is the the disorder doesn't go away. So some of the deficits don't go away without active teaching.
Right.
Right. So whereas a typically developing kid will gain receptive language skills, will gain expressive language skills, almost in the absence of direct teaching anyway. They're learning it somewhere, but not in the absence of direct teaching.
Right.
Individuals with autism, if they're not going to gain those skills, we're going to have to come in and directly teach.
Yeah, no, absolutely. All right, so that's great. It kind of sort of sets the stage. And after the break, we're going to bring Dr. Helen Hu up, and she's going to talk to us a little bit about more about challenging behaviors, and then we're going to get into some of the things that parents and teachers might be able to do to prevent them from happening. Mm-hmm. So we'll see you right back after the break. Welcome back to Autism Today. Our second guest is Dr. Helen Hu, and Helen is a psychologist at the Institute for Basic Research. Welcome to the show.
Thank you for having me.
Maybe you could tell us a little bit about what you do at IBR, which is right here on Staten Island.
Sure. I work as a research scientist in the Department of Psychology, and most of my time is spent on managing projects related to challenging behaviors in children with autism. Mm-hmm. I also provide trainings to teachers and psychologists, and I also consult with various agencies across New York.
Great. Great, on managing challenging behaviors,
yes,
I'm assuming.
Yes.
So, great. We're basically talking to parents and to teachers, and one of the things I know that when we want to treat a challenging behavior, the first thing we have to do is figure out, why is this happening? So maybe you could just talk a little bit about why do problem behaviors occur? What are we looking for in terms of?
Typically, children don't act out without a reason.
Right.
And most of the time, it's to get good stuff and to avoid bad stuff, just like the rest of us. Mm-hmm. There are 4 commonly occurring reasons or functions that I'll cover briefly here. The first one, and this is in just random order, the first reason may be that the child acts out in order to gain attention.
Right.
In the form of social interaction or a surprised reaction from a parent, or even reprimands.
Sure.
And that's surprising to you and I because reprimands are very unpleasant.
Yeah.
However, to a child who seeks out attention, reprimand may be better than no attention at all.
I had a parent who, this child kept pouring liquids. Every time there was a cup full of something, he would pour it on the rug, and the mother said to me, I don't know why he keeps doing it, because every time he does it, I yell at him. Mm-hmm. And it was very obvious that he loved mm-hmm. being yelled at, and so all that did was increase the rate mm-hmm. of which he would pour things on the rug.
That's a perfect example.
Yeah.
The second one that I would mention is access to tangible. That's when a child acts out in order to obtain goods like toys, food items,
sure.
And access to television or games.
Right.
So that's another condition or function of the challenging behavior.
And just to kind of illustrate that point, you know, part of the problem with when you want something, mm-hmm. I had a family and the child loved being outside. So of course one day he really wanted to go outside, but it was lightning out. And they don't understand that, no, you can't go outside. Right. You can't always have what you mm-hmm. want. So it can be very difficult if you can't explain that they're in danger by going outside. So.
That's perfect. The third function I'll mention is escape or avoidance of unpleasant situations, like being in a overly stimulating environment that's very loud, or being presented with difficult tasks like academic tasks, mm-hmm. tabletop tasks. And for children with autism, changes in routine, going from one activity to another, transitioning,
right, sure.
Is difficult. So some children engage in challenging behaviors to avoid that.
Right.
The last function I'll mention is that the behavior itself may be producing the feeling that the child likes or enjoys.
Sure.
And this is a case in repetitive behaviors that children engage in. When you see them left alone with other things to do, they rather engage in those repetitive behaviors, which may indicate that the behavior itself is producing the feeling they like.
Right, so they'll do it whether there's people there or not.
Exactly.
Right, but the problem obviously with those behaviors is that they interfere with the skill acquisition. You know, I mean, we all engage in what we would refer to as self-stimulatory behaviors, but we don't do it at the rate, and we don't do it when we're supposed to be learning something. So now you do a lot of work with schools, and I know that in school often we're presenting children with difficult tasks. There are a tremendous number of transitions. We're often telling them they can't have something. So there's all these setting events that would cause problem behavior. I'm a teacher. I come to you and I say, I have a child who's engaging in really difficult behavior. Where do I start? What would you do to start to treat that problem behavior?
Well, it can be very overwhelming to work with the child with challenging behaviors. The first thing I would tell the teacher would be that children with autism can learn more appropriate behaviors and learn ways to communicate his or her wants better instead of engaging in challenging behaviors. What I would suggest is actually to utilize what the teachers are already doing. Many teachers are familiar with ABC data collection. And let me explain what that is.
Right.
A stands for antecedents, what happens before the behavior, what may trigger the behavior to occur. B, of course, is the target behavior. The C part is the consequence, what happens after the target behavior. And that may indicate what's maintaining the problem behavior. So the teacher may be providing the child with something they want after the child misbehaves.
Right.
So an example would be providing the child with timeout when the child engages in aggressive behavior in order to get out of work.
Right, that happens a lot, right? Because in many schools, I remember consulting to a school, and there was a young man who just started this school, and he was overwhelmed by the transitions, and every time that he had to go into a different environment, he would have a tantrum, and then they would take him down to the principal's office, where the principal would calm him and give him a cookie. He learned very quickly that I'm just going to tantrum because it works far better.
That's right. So it's very important to go back to the data you've been taking and look for those routines. What's maintaining the problem behavior, and try to break out of that cycle. So the example I gave earlier with the timeout for challenging behavior, some of the ways to alleviate that would be to teach the child to communicate and ask for a short break.
Sure.
Another thing that the teacher can do is to break down the task that you present to the student into smaller, more manageable steps so that the student can experience success.
Right, yeah. So I think it's very important, obviously, the point you're making is that we cannot treat a problem behavior in autism unless we know why it's occurring.
Exactly.
And we have some pretty good systems that are available to us as psychologists, as teachers, as practitioners, as parents, to try and figure out why these problem behaviors occur. You know, once we know why they're occurring, we can then try and change the contingencies. When we come back, so you know, we're going to continue to talk about strategies, because I know obviously the most